Well, it's a move that would create jobs and also reduce wait times for patients. Today, the University of Nebraska Medical Center announced they are one step closer to a Department of Dermatology.
Chase Moffat's been digging into the details of the plans, and he joined.
Yeah, that's right, John and Mallory. The move by UNMC comes at a time of growth within the entire Nebraska medicine system. In fact, as we know, the Buffett Cancer Center set to open this coming spring. But what I'm learning by one doctor I spoke with today, they're seeing on average about one case of melanoma a day. Now, the problem with that is on two fronts. First, currently there's no pipeline for dermatology jobs within the state. And second, to get that melanoma checked out, you're going to have to wait upwards sometimes of several months. Now, Dr. Dominic DeMaio with University of Nebraska Medicine Medical Center in the Department of Pathology and Microbiology tells me that to get a better picture of medical issues centering around skin, hair, and nails, it takes two departments. One that you see here where he's using a microscope to look at the issue on a cell level, and the second is a clinical setting. Someone like a dermatologist could help with the external issues.
We have surgeons who are interested in melanomas, we have oncologists who are interested in melanomas, and we have people like myself who are interested in skin diseases. But we really need a dermatologist to have a complete picture and in terms of complete treatment of the patient.
Now, additionally, according to the College of Medicine Dean at the University of Nebraska Medical Center, because there is no residency program for dermatology, any student wishing to continue their education will have to leave.
One of the challenges is that when people finish their residency training, most people, and it's not just dermatology, it's all specialties, usually end up going into practice within 50 or 100 miles of where they finished their training.
So what I'm learning is that in order to create this department, it will also hopefully create more jobs. Now, part of this is also something he calls teledermatology. That's video-based services for places like in western Nebraska where the population may be more scarce. And also moving forward at this point, it's up to a state higher board of education to make sure that this can move forward. That would be in July when they make a decision. John and Mallory.